As a neonatologist, I'm considered an expert in the care of babies. Newborns sleep a lot. They need appropriate sleep for their bodies to grow. So we want to provide a safe environment for them to sleep in. If you think about newborns, they don't have the strength to move their head if their airway or their nose or their mouth became blocked. But we've learned that there are things that we can do to minimize that risk.
We've all heard about babies dying while they are asleep, and as parents, we want to keep it from happening, but how? When an infant under the age of 1 dies suddenly and unexpectedly, without an obvious cause, this is called sudden infant death syndrome. This is a vague classification and part of what makes SIDS so scary. Some people don't know that an unsafe sleeping situation for the baby can cause suffocation, which leads to death. And this is much more common than SIDS. Suffocation happens when a baby's airway is blocked and air cannot reach the lungs. This can happen by a baby being trapped between two objects, like a mattress and a wall, when someone accidentally rolls on top of a baby, or when something gets wrapped around a baby's neck. We want to teach you how to create a safe sleeping environment for your baby so this doesn't happen to you. Sometimes, parents mistakenly think they can keep a closer eye on their baby to protect them from choking, insects, falls, and other injuries if the baby is in bed with them. Sometimes, they even feel the need to watch them closely to make sure they are still breathing. As parents, we want to protect our precious babies as best we can. We want to believe they are safer when they are with us, but studies show that babies are most safe when sleeping by themselves in a crib. The American Academy of Pediatrics has created some easy steps to follow for safe infant sleep. A complete list of do's and don'ts can be found at aap.org. Babies age 0 to 12 months should always sleep in a safety-approved crib, portable crib, play yard, or bassinet at night and during naps, sleep on firm surfaces with tightly fitted sheets, sleep in the same room as the parents, but not in the same bed. It's room sharing without bed sharing. Babies should always be placed on his or her back for every sleep time, be kept warm by using a sleep sack or long-sleeve footed pajamas, return to his or her crib after nursing before mom falls asleep. In an infant carrier, make sure baby's head is up and above the fabric with face totally visible and the nose and mouth are clear of obstructions. Babies aged 0 to 12 months should not sleep with soft objects or loose bedding in the crib. This includes pillows, blankets, stuffed toys, and bumper pads. Be placed on their side or stomach for sleeping when they can't roll over by themselves. Be placed in wedges and positioners. Be exposed to smoking during pregnancy or after delivery. Be exposed to alcohol and drugs. Experts also warn against swaddling an infant, which can bring additional risks into their sleeping environment. These risks include respiratory infections, hip dysplasia, overheating, and suffocation.
Newborns are cute. They're cuddly. We all want to hold them and snuggle with them. But we also want to do the safe thing for our newborn. And putting a baby in its own safe sleeping space is the safest thing you can do for your baby.
Remember, when mom, dad, or caregiver is asleep, babies should be in a firm crib by themselves without any loose bedding or toys and on his or her back. This will minimize any external factors that may pose a threat to your child's life. And since newborn babies sleep so often, it's important to keep their environment extra safe. Because nothing is more beautiful than a sleeping baby, especially one that's safe.